Ladies and gentlemen, welcome to the 2018 FAH Public Policy Conference and Business Exposition. Please rise for our national anthem.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Please be seated. Now, welcome to the stage Wayne Smith, Chairman of the Federation of American Hospitals and Chairman and CEO of Community Health Systems.
If I were 50 years younger, I'd volunteer for the military again after that rendition. I mean, that was fabulous. Good morning, everyone, and welcome to the Federation of American Hospitals 2018 Public Policy Conference and Business Exposition. From the exposition floor to our speakers and panel discussion, we have a great agenda for you over the next few days. And it all starts in just a few minutes when we will hear from our new secretary, Azar. Before we begin, I want to thank all of our sponsors for making this meeting possible. You'll see their names highlighted on the video screen just behind me. It goes without saying that we are deeply grateful for your support. Support is what has gotten us through the past 12 months. I've been involved in healthcare for decades. I don't like to say that, but I've never witnessed a year in Washington like 2017 with so many ups and downs for hospitals. We faced a long list of challenges, and many of those came to conclusion in wildly dramatic ways, from a late-night thumbs-down vote in Senate to welcome but unexpectedly regulatory decisions. There were also unprecedented natural disasters and human tragedies. These events took a toll on our communities and our facilities and our team members. But no matter the test, our industry answered the call, making sure our patients and our people were always taken care of. That's what our communities expect of us, and that's what hospitals do. Though it is fueled by the leaders in this room, the Federation of American Hospitals was there in D.C., reminding policymakers and legislators that every decision should be centered on patient access and quality care. Our nonstop advocacy year included several starts and stops on legislative effort to repeal the Affordable Care Act. Congress also passed a once-in-a-generation tax reform, though it's unfortunate that it had a rider the repeal of the individual insurance mandate. Despite all the turmoil, we had an amazingly good year on the regulatory front. The new administration recognized the discounting our industry does for uninsured and changed the calculation of how Medicare DSH payments are made accordingly. And when it comes to prescription drugs, the administration moved in the right direction, 340B reform. This will help all hospitals deal with the chronic Medicare underpayments. No doubt 2017 left us with some bruises, but we survived the worst and came through it stronger. All our hard work paid off. Access to care remains strong, and no matter the circumstances, our hospitals continue to serve their communities 24/7. But we can't rest when it comes to standing up for our patients. It seems there's just one truth here in the nation's capital these days. The future is and will remain unpredictable. Nothing's changed in that regard. Challenges remain. The latest budget from the administration outlines future threats from reimbursement cuts to possible changes in Medicaid and Medicare. No matter what we face, we will continue to fight for the resources necessary to make sure that hospitals can always provide the essential services that people in our communities, big and small, have come to rely upon. For more than 50 years, the Federation has built a reputation of being ahead of the curve and always willing to come to the table with constructive solutions. Those skills will be needed in 2018 and beyond. We stand ready to work with lawmakers and policymakers to achieve the shared goal of improved Americans' healthcare system through patient-centered care. Now it's time to honor this year's winner of the Chorus Board Leadership Award. I would now like to invite Jerry McKinney of Quorum Health, the chair of the Federation's Exposition Advisory Committee, to come to the stage to recognize this year's honoree. Welcome, Jerry.
Thank you, Wayne. I'm honored to be here with you today and to once again play a role in this great conference. The Exposition Advisory Committee sets the guidelines for our extremely successful exposition, and we also plan the educational workshops that you will attend during the conference. Planning the workshops requires hard work and dedication on the part of every member of the committee, and I want to thank them all for their commitment to the effort. We have a special guest with us today to help present the Federation of American Hospitals Chorus Boyd Award. We are joined this year by Chorus's wife, Vanessa. Vanessa? As many here know, this award is given annually in memory of our late friend. Chorus Boyd was an exceptional person and an outstanding leader in workplace diversity. This award is our way of keeping his legacy of excellence going, and we are happy to have Vanessa here to take part. It has become a tradition to surprise the winner, and this year is no different. So our winner is out there, but just doesn't know it yet. Words used to describe this year's Chorus Board winner include supportive, a leader, a mentor, and someone committed to excellence. This person has served the healthcare provider industry for nearly 20 years, specializing in supply chain performance improvement and management solutions for organizations including Christus Health, Resource Optimization and Innovation of Mercy Health System, Alvarez and Marsal, Ernst & Young, and Deloitte Consulting. He currently serves as Senior Vice President for Supply Chain Management at Beaumont Health. As one nominator wrote, the culture and leadership style he exhibits filters down to his direct supply chain leaders, creating a more cohesive supply chain business unit. But if you talk to those who know him best, they will highlight his not only his professional accolades, but his personal attributes. His passion, his desire to see those around him succeed, and his dedication to diversity. These are all reasons that Edwin Harden of Beaumont Health is our 2018 Chorus Boyd Leadership Award winner. Ed, please come to the stage and accept your award.
Ladies and gentlemen, please welcome to the stage FAH President and CEO, Chip Kahn.
Well, good morning and welcome to this year's Federation Annual Policy Meeting and Exposition. I'm so glad to see you all. Very excited about the program which we're kicking off this morning and this afternoon. I think you'll really enjoy all of it. I'd like to first, though, thank Wayne Smith for serving as our chair this year, 2018. He has done so much for our industry during his career, and his dedication to improving the business environment for hospitals is unquestioned. Also, let me express my congratulations to Ed Hardin for winning the Corus Boyd Award and for being a unifying leader in our industry, and welcome to Vanessa Boyd, who I spoke with backstage. Your husband made a lasting impact on our organization and industry. We are proud to give an award bearing his name, and we miss him dearly with you. So now, on to the first speaker this morning. Now, he is our keynote, and it's a special morning for us. He has just returned to the policymaking spotlight, and those of you in the industry who have known him for many years so look forward with all of us to his leadership. I have the honor of introducing our new Health and Human Service Secretary, Alex Azar. We are thrilled to be the first major public venue for the Secretary. While he has only been in his position 5 weeks, he spent his entire career both in public and private sectors, focusing on advancing the nation's healthcare research and innovation. There is no doubt that his tenure will have huge impact on healthcare delivery and financing, and that the system will be better for all Americans having this secretary at the helm. I have had the pleasure of working with Secretary Azar in the past and believe his knowledge of the issues, the possibilities of his department, and his openness to listen and work with all sides make him a perfect pick for the times. I remember back to 2005, and he and I were discussing this backstage, when during the Katrina crisis, and the Federation had so many hospitals in New Orleans at that time, clearly, as you watched it, on the TV unfold, there were a lot of problems. A lot of problems with the way the administration, or parts of the administration, handled it. And I can just say that from my interaction with Alex, it was he was the one that made things happen, and made things happen for us, the people on the ground, and for the hospitals that we serve. And I so appreciate his commitment then, and the example that he set at that time, and the example he will set for us as our new secretary. So please join me in welcoming HHS Secretary Alex Azar to the stage.
It's a pleasure to be here with all of you today. I want to thank Chip and all of the Federation's members for inviting me to share our vision for HHS and America's healthcare system, and how we hope to work with all of you to make it a reality. One of the key commitments that President Trump has made across the administration has been to see the private sector as our partners, not just as entities to be regulated or overseen. That charge has been taken seriously at HHS from day one. We at HHS see stakeholders, including our nation's hospitals, as part of the solution to our country's many healthcare challenges. We recognize that it's not just government that wants better healthcare for all Americans. Our partners in the private sector, all of you, want the same. It's an exciting time to take over the helm as Secretary of HHS. It's full of both challenges and opportunities. The same goes for our stakeholders as advances in science are transforming medicine. It seems like it's every other week that FDA is approving some novel therapy, or NIH announces a finding that revolutionizes how we think about a key piece of biology. But innovation in payment and delivery systems is simply not proceeding at the same pace. When I was at HHS in the 2000s, concepts like personalized medicine and cell therapies for cancer were in their infancy. Now, personalized medicine has come to life, and cell therapies are receiving FDA approval. Meanwhile, on the delivery side, back in the 2000s, shifting to value-based systems was just getting going as well. And yet, here we are today, more than a decade later, and value-based payment is still far from reaching its potential. So this is no time to be timid. Today's healthcare system is simply not delivering outcomes commensurate with its cost. While we've conquered many healthcare challenges in recent decades, chronic diseases remain a painful, expensive burden on Americans' lives. In many cases, these diseases are increasing burdens, and our system is poorly set up to treat them. The opioid epidemic facing our country is one of our greatest public health challenges, stealing tens of thousands of lives from us every year, even though we know that addiction is a treatable disease. On top of that, of course, the current trajectories in health spending are both unsustainable and unmatched by increases in quality. Just since I first arrived at HHS in 2001, our budget has expanded from just under $400 billion to $1.2 trillion today. We are bigger than the entire British Empire. You might like the idea of coming back to run a hospital system that's 3 times as big as it was when you first started there, but I assure you that is not how we feel about the federal government. Federal spending on our major healthcare programs is projected to rise from 5.5% of our economy in 2016 to 8.9% of our entire economy 30 years from now. By themselves, these programs will consume almost all of the income taxes collected by the federal government. It would be one thing if this were accompanied by increasing quality. Spending 20% of GDP on healthcare to boost our life expectancy to 100 years sounds like a pretty good deal. But that's not the deal we're getting right now. As all of you know, part of the problem happens to be the equation that we've used for healthcare in this country for decades now: paying for procedures and sickness. For over a decade, we've been on a journey to replace that equation with a new one, paying for outcomes and wellness. But that transition needs to accelerate dramatically. Imagine a day when healthcare delivery in the United States functions the way other parts of our economy do. We as patients would pick providers with the level of information we have when using Amazon or Yelp. Consumers would drive quality and cost effectiveness with information, competition, and genuine choice. Now, some argue that healthcare is simply different, that it is and should be immune from market forces. I simply disagree. Real competition, in the economic sense, has never really been fully tried in our bizarre third-party payer system. Upon taking office at HHS, I identified the value-based transformation of our entire healthcare system as one of the top 4 priorities for our department. The others are combating the opioid crisis, bringing down the high price of prescription drugs, and addressing the cost and availability of insurance, especially in the individual market. Value-based transformation, in particular, is not a new passion for me. It became a top priority for Secretary Mike Leavitt when I was working for him as the Deputy Secretary of HHS. And it was taken seriously by President Obama's administration as well. But it's been a frustrating process. Providers have understandably been reluctant to charge into a completely new payment paradigm. Massive new processes and data gathering requirements have been instituted without any fundamental changes to our delivery system. Results for the early stages of federal efforts to encourage accountable care organizations have been, to be honest, underwhelming. But there's no turning back to an unsustainable system that pays for procedures rather than value. In fact, the only option is to charge forward, for HHS to take bolder action, and for providers and payers to join with us. This administration and this president are not interested in incremental steps. We are unafraid of disrupting existing arrangements simply because they're backed by powerful special interests. Today, I want to lay out 4 particular areas of emphasis that will be vital to getting where we need to be. The 4 areas of emphasis are the following: giving consumers greater control over health information through interoperable and accessible health information technology, encouraging transparency from providers and payers, using experimental models in Medicare and Medicaid to drive value and quality throughout the entire system, and removing government burdens that impede this value-based transformation. The key theme uniting these 4 priorities is the recognition that value is not accurately determined by arbitrary authorities or central planners. It's best determined by a marketplace of many players. In the case of healthcare, patients, and where necessary, their third-party payers. Each piece of our plan for value-based transformation recognizes this, and it's the main reason I'm optimistic that we may have more success, and sooner, than past efforts. But I want to emphasize that this will not necessarily make the process easier, and certainly not more painless. Putting the healthcare consumer in charge, letting them determine value, is a radical reorientation from the way that American healthcare has worked for the past century. In fact, it will require some degree of federal intervention, perhaps even an uncomfortable degree. That may sound surprising, coming from an administration that deeply believes in the power of markets and in competition. But the status quo is far from a competitive free market in the economic sense of the term. And healthcare is such a complex system that facilitating a competitive, value-based marketplace is going to be disruptive to existing actors. Simply put, our current system may be working for many, but it's not working for patients, and it's not working for the taxpayers. The 4 shifts I'm going to outline today are absolutely necessary to getting to a system that rewards value and works for the patient. Today's an opportunity to let everyone know that we take these shifts seriously, and they're going to happen one way or another. I'll start with the information and technology piece because HHS and the White House will be announcing some exciting news on this very front this week. In the years since we were talking about this very topic around Secretary Leavitt's conference room table, technology has advanced by leaps and bounds. The ubiquity of smartphones, cloud-based storage and computing power, and near universal access to the broadband internet has changed the way we keep and consume information. When we began this journey, Secretary Leavitt warned us of electrifying a system without standards to ensure interoperability, lest we simply entrench a balkanized system. In recent years, we've seen substantial advances in adoption of electronic health records by providers, but all too often, this simply meant putting in electric form what had been on paper, at great expense and burden to the provider. Useful, but hardly realizing the promise of health IT. And this shift almost entirely left the patient out of the picture. It's not just that the benefits of health IT aren't always apparent to patients. It's that unless we put this technology in the hands of patients themselves, the real benefits will never arrive. Empowering consumers and individuals has been key to the advances of the information age. Think about how we now often make restaurant reservations through apps like OpenTable. From the restaurant's perspective, There was nothing wrong with a ledger of reservations or maybe a business-focused program for tracking tables. But as a consumer, you had to call from restaurant to understand when and where there were tables available. Now, if I pull out my smartphone to make a reservation for dinner on a Saturday night, I have all that information at my fingertips. I'm not depending on the person who answers the phone to get it right. I'm the one in control of the whole process. I can see the available choices. I make an informed decision, and I've got the record in my hands. We already have the technological means to offer this power to patients, but it hasn't yet happened. The key to this administration's approach will not be micromanaging the standards and processes used. We are much more interested in setting out simple goals. Patients ought to have control of their records in a useful format, period. When they arrive at a new provider, they should have a way of bringing their records, period. That's interoperability, the what, not the how. Too often, doctors and hospitals have been resistant to giving up control of records and make patients jump through hoops to get something as basic as an image of a CAT scan. The healthcare consumer, not the provider, ought to be in charge of this information. But we do know that the barrier is not always the provider's decision to shield that information. Sometimes it's that there aren't systems for easily disseminating it, and we aim to work with the private sector to open up avenues that will empower patients. In fact, tomorrow at the HIMSS conference in Las Vegas, CMS Administrator Seema Verma and Jared Kushner of the White House Office of American Innovation will be making important announcements about actions this administration will be taking to put patients in control of their own health data and spark private sector innovation in this space. Putting patients in charge of this information is a key priority. But if we're talking about trying to drive not just better outcomes but lower costs, we also have to do a better job of informing patients about those costs. That's where our emphasis on price transparency comes in. I want to share with you a personal story about this because I think it speaks to the powerlessness consumers can often feel on our health system. At a time when through high deductible plans, we're asking them to take charge of their own care and decisions. A few years ago, my doctor back in Indiana wanted me to get a routine echocardio stress test. I figured this could occur within the scope of his practice, which was connected to a major medical center. Instead, I was sent a few floors down, where I was told to start handing over all sorts of information to a receptionist. Soon enough, I've got a plastic wristband slapped on me. And to my surprise, what I thought would be a simple test in the room next door had resulted in my being admitted to the hospital. Now, I had a high deductible plan, so I would be paying for this test out of pocket. As someone who works in healthcare, I knew that the sticker price on the test had just jumped dramatically by my receiving it within a hospital, something that might never occur to most healthcare consumers. So I asked how much the test was going to cost, and I was told that information wasn't available. Fortunately, I didn't just fall off the turnip truck, so I persisted. And eventually the manager of the clinic appeared and gave me the answer. The list price was $5,500. I knew that wasn't the right answer either. Well, for many reasons. The key piece of information was what my insurer would pay as a negotiated rate or what I'd pay with cash. That information didn't come easily either. But eventually, I was told it would be $3,500. Now, I happen to know of a website where you could search typical prices for such procedures. So I looked up what it would have been if I'd received it outside the hospital, in the doctor's office. The answer? $550. Now, there I was, the former Deputy Secretary of Health and Human Services. And that is the kind of effort it took to find out how much I would owe for a procedure. What if I'd been a grandmother? Or a 20-something with a high deductible plan? This is simply wrong. It cannot continue. If, as most people in America agree, we want some degree of a consumer market when it comes to health care. I believe you ought to have the right to know what a healthcare service will cost and what it will really cost before you get that service. This is a pretty simple principle. We'll work with you to make it happen and lay out more powerful incentives if it doesn't. To go back to my restaurant analogy, imagine if you have to order before knowing what anything costs. Indeed, before ever seeing the menu. And once your bill finally does arrive, not only are you paying for your appetizer, entree, and dessert, you get a surprise bill from the off-site pastry chef, too, who's not in network, by the way. No one would ever put up with such a system, especially if we want to put patients more in charge of their own healthcare dollars. Providers and insurers have got to become more transparent about their pricing. There is no more powerful force than an informed consumer. The good news is that you all can begin taking steps in this direction right now. Some insurers and employers have created tools that show people what different local providers charge for a procedure. The information's correctly grouped together so you don't have to add together the doctor's charge, the hospital's charge, and the cost of other services. If you log in with your insurance information, it shows you how much you will pay out of pocket. Now, lest you think I'm singling out hospitals, the current problem is not limited to providers or payers. The same applies for prescription drugs. Your pharmacist typically cannot tell you the real price you're going to pay for a drug and therefore your out-of-pocket cost until they actually create a claim. So transparency is a crucial piece of our efforts to bring prescription drug prices down too. In both healthcare services and pharmaceuticals, the huge gaps between the list price and the actual price are notorious. It's like the gap between the $500 rack rate on the back of the door in your Hampton Inn room and the $100 you actually pay. This thicket of negotiated discounts makes it impossible to recognize and reward value, and too often generates profits for middlemen rather than savings for patients. So this administration is calling on not just doctors and hospitals, but also drug companies and pharmacies to become more transparent about pricing and outcomes of their services and products. And if that doesn't, we have plenty of levers to pull that would help drive this change. The third piece that we're looking at is using Medicare and Medicaid to drive the value-based transformation of our entire health system. Federal spending on Medicare and Medicaid amounted to just over $1 trillion in 2016, 1/3 of America's total health spending. If we're serious about transforming our health system toward paying for value, Medicare and Medicaid will play a key role. Only Medicare and Medicaid have the heft, the market concentration, to drive this kind of change, to be a first mover. In addition, as we all know, commercial payers often mimic the fee-for-service payments that come out of Medicare. If we don't change those, nothing will change. We already have a range of tools for using these programs to pay for value, many created by 2015's MACRA legislation. The Center for Medicare and Medicaid Innovation, alongside these tools, vests HHS with tremendous power to experiment with new payment models. Of course, we will be transparent and collaborative as we experiment here. We're mindful that aggressive models have not always worked out in the past, so appropriate guardrails will always be essential. But make no mistake, we will use these tools to drive real change in our system. Simply put, we don't intend to spend the next several years tinkering with how to build the very best joint replacement bundle. We want to look at bold measures that will fundamentally reorient how Medicare and Medicaid pay for care and create a true competitive playing field where value is rewarded handsomely. As just one example, we're looking at our efforts regarding accountable care organizations. The program was intended to give providers 3 years to learn how to accept risk and share savings, but the results have been lackluster. In retrospect, this isn't such a surprise. Providers were not given new, meaningful space to experiment, such as the arrangements they need to truly take on the risk of a patient's outcome. Meanwhile, they were allowed to share in modest cost savings, but not asked to accept responsibility for cost overruns. And to the extent that we're collecting quality measures ourselves, we want to make reporting as easy as possible. Nobody benefits when our outcomes measures create burden instead of value. It's the patient who suffers when a provider spends more time reporting quality measures than delivering quality care. In all of this work, we've been informed by your responses to CMS's request for information. They've been immensely valuable, and we will act on them. We'll also bear in mind whether new burdens created by models or the scale they require for viability may be driving or will drive consolidation in the healthcare market. As a matter of principle, we want to move to a system where we can be agnostic about ownership structures, a system that will allow independent providers to group together to drive innovation, quality, and competition. This brings me to our fourth key engine for transformation: addressing any government burdens that may be getting in the way of integrated, collaborative, and holistic care for the patient, and of structures that may create new value more generally. One example is the reporting burdens I just discussed, but there are many other regulations that may be impeding value-based transformation. Certain Medicare and Medicaid price reporting rules, for instance, as well as restrictions in some FDA communication policies, may be getting in the way of innovative ways for pharmaceutical companies and payers to work together towards driving value. In addition, current interpretations of various well-meaning anti-fraud protections may actually be impeding useful coordination and integration of services. As just one tangible example, one not insignificant challenge in modern medicine is simple but persistent. How do we get patients to show up for their appointments? Many providers have taken advantage of the recent rise of ride-sharing services to provide reliable, low-cost transportation to appointments. But an array of federal regulations has limited the degree to which this can occur. The amount of free rides that can be provided to a patient in a given year, for instance, is strictly limited. These are the kinds of wraparound services that can often improve outcomes at incredibly low cost. We're devoted to figuring out ways for providers to take advantage of them. I want to end by laying out why I'm so optimistic that we can tackle these longstanding priorities under this administration. First, the time's simply come. As costs continue to skyrocket, the current system cannot last. But it's also because this administration is unafraid of disruption in the way that many political actors often are. President Trump is a man of courage and vision. He has seen and heard how the high cost of health care is burdening working-class Americans, and he has given us a mandate to do something about it. The measures I outlined today will get us part of the way. In order to bring down costs and increase quality, we have to put patients in charge of their own data, provide them with useful, transparent price and quality information, use Medicare and Medicaid to shift towards a value-based system, and get government out of the way of such a system. This won't be the most comfortable process for many entrenched players, but those who are interested in working with us to build a value-based system will have the chance to take advantage of a market where consumers and patients will be in charge of health care. We believe that is a system that will serve patients first, but it will be fair for providers and payers too. I am determined that we will look back at the years of this administration as a pivotal inflection point in the journey toward value-based care. And we want you to join us on this journey. So thank you all for listening today and for your ongoing engagement with our administration. Change represents opportunity, and I exhort all of you to take advantage of the opportunities represented by what I've discussed today. Because I assure you, change is possible, change is necessary, and change is coming. Thank you very much.
Thank you, Mr. Secretary. That was great, and we so appreciate you coming this morning, and we're happy to provide a venue for one of your opening acts. We look forward to much accomplishment. So, now let's move on to some housekeeping and scheduling items. Following this opening session are the luncheons. Then we'll convene right here at 1:30 p.m. to hear from a lively and distinguished group of members of Congress and the executive branch. First off will be Congressman, I should say Chairman now, Peter Roskam from Illinois, who was just chosen by his colleagues to lead the Health Subcommittee for the Ways and Means Committee. He will be followed by Senator Todd Young of Indiana. Senator Young is sort of one of the comers in the Republican caucus conference in the Senate. He serves on the Senate Health Committee, which has jurisdiction over health issues. Also on that committee, and speaking today from the Democratic side, will be Senator Tim Kaine of Virginia. He is best known as Hillary Clinton's running mate in 2016, but in the Senate, he has been active on health issues. He sits on the dais with Senator Young as a fellow member of the Health Committee. Our last legislative speaker will be Representative Kirsten Sinema of Arizona. She serves on several health issue caucuses, including those related to nursing, Parkinson's disease, and Alzheimer's. And wrapping up will be Andrew Bremberg, Assistant for Domestic Policy and Director of the Domestic Policy Council at the White House. He is the point person for the White House when it comes to all the important health care issues. We are really excited about each of these speakers and hope you will join us this afternoon at 1:30. Then tomorrow, we will convene for a plenary session at 8:30 a.m. and hear from our keynote speaker of the day, General Michael Hayden. He is a retired four-star general who served as director of both the CIA and the National Security Agency, and I'm sure you will recognize him as a frequent guest on cable news network and the Sunday morning shows. With everything happening internationally, from China to Russia to North Korea, I'm sure he will have some very interesting observations about what is happening around the world and what we should be worrying about. And during our luncheon tomorrow, a peek behind the legislative curtain, we will hear from 3 Capitol Hill staffers and get the scoop on what is happening in healthcare policy up on the Hill. We hope to see you at each of these sessions, and we hope that your work throughout the meeting and in the exhibition hall is successful. We are now adjourned. After lunch, I look forward to seeing all of you here this afternoon. Hope you have a great meeting over the next 2 days. Thank you.
I was born in a small town, and I live in a small town.